Hi, I'm Sharon. I'm a health champion in West Hove, which is part of NHS Sussex.
I became involved in voluntary activities within West Hove when I stepped away from full-time employment. My background is actually in social care and health.
I've been a health champion since I began to be a participant in a patient participation group, which was initiated in my practice in Portslade by my local GP, who invited me to take part in that. Some of the exercises that I've been involved in since I've been a health champion have involved the development of a diabetes pathway. I've also supported a commissioning exercise which is around the recommissioning of short-term beds for rehabilitation purposes. Just at present, part of the work that I'm involved in, which is quite exciting, is the redevelopment of a website for our local practice. So I'm being used as a sounding board to ensure that the information that's going out to patients is both meaningful and accessible. Another area of work that is very exciting for me at present is my involvement on the Primary Care Network Board. That came about because the clinical director for us locally, whose name is Rowan Brown, invited both myself and the chief executive of our local voluntary sector to be part of that board at its inception.
It's important to emphasise how significant the invitation from Dr. Rowan Brown for myself as a layperson and for Joe Martindale, who's the chief exec of the Hangleton and Knoll project, to take a seat at the Primary Care Network board table. He has been an encouraging general practitioner, was very supportive of activity within the patient participation group locally in Portslade, but has been in turn a real champion of patient voice and continues to really encourage participation.
It's probably important to mention that the link between being a patient and part of a participation group and being a health champion for us locally is down to being recognised as people who involve themselves locally in a range of activities, both within the voluntary sector and health related. Sometimes you'll hear the term health champion used alongside community champion. And locally, we think it's really important to recognise that people can play a role in all sorts of ways that actually impact in terms of health outcomes. We're very fortunate in West Hove to have a very active voluntary sector, and there is a health forum for which any member of the public who's involved in any way and is interested in health issues can come along. And what has been really significant is since I have been offered the role on the Primary Care Network board, it's very visible locally that there is a link between the Primary Care Network agenda, information and feedback that happens at the forum, and the information that can then be disseminated out to the general public and be heard by patients, by the public, and increasingly we talk about residents and their participation in all the issues that are affecting them in the community.
I'd really encourage anyone that's interested at all in what's happening with their local health services and in the wider community to be involved. People come from a variety of backgrounds. There's a wide, diverse group of volunteers who are active within our local area and across the country. And each one of them, and we certainly saw this during COVID, when people stepped forward to be volunteers to roll out the vaccine programs, all of them were health champions during that period. Everyone has a contribution to make, and it would be great to see more people step forward and participate. Our role really is to link issues and activities that are happening for us locally and to facilitate a healthy dialogue between ourselves as patient representatives, service users, residents, with health and other wider professionals, and to ensure that we're all working to support the agenda in as many possible ways that we can.